So as everyone who joined tonight knows, Zioness wanted to provide an opportunity for the National Zioness family to come together and celebrate Shabbat and bring in some light into all of our homes and communities during this very difficult time. People are feeling so disconnected from each other, from the people and movements that we care about, from our normal Shabbat rituals with friends and extended family members that right now we have to protect by celebrating separately, but still together. We are so thrilled to be able to share the Shabbat experience with all of you and to learn, engage, have some fun, and end the evening with a sweet treat. And we are thrilled and grateful beyond words to begin the evening with two extraordinary leaders of women's health and women's rights in this country, and to offer Zioness as the opportunity to get updated on the state of play and have some action items to take away from you on how we can advance the women's agenda even while we're stuck at home, safe at home, I should say. So please put your questions in the Q&A box. We will do our best to get to as many of them as we can. We do have a lot to cover in a short period. Please also, as I said, go to the Zioness page and feel free to share the live stream of this event and tell them about Zioness, which you all know is a domestic social justice activist organization for Jews and allies who want to be proudly Zionist and also proudly progressive, to show up for social, racial, economic, and gender justice in America without checking any piece of our identities at the door, being proud of our Zionism, and being committed to all of the issues that we care about here in the United States. We are a new and rapidly growing organization representing this unabashedly progressive, unapologetically Zionist voice of the vast majority of American Jews. And as you know, our work is critically urgent, especially in this moment. So let's get to it. It is truly my absolute pleasure to introduce Attorney General Letitia James and ACLU Ohio Legal Director Freda Levenson. Letitia James, Tish, is the 67th attorney for the state of New York. She is an experienced attorney and public servant, the first woman of color to hold statewide elected office in New York, and the first woman to be elected attorney general. In 2013, now AG James was elected public advocate for the city of New York and became the first woman of color to hold citywide office. Her office handled over 32,000 constituent complaints and passed more legislation than all previous public advocates combined, including a groundbreaking law that banned questions about salary history from the unemployment process to address the pervasive gender gap. As public advocate, now AG James successfully took on the gun industry by pushing New York City's largest pension fund to divest from gun and ammunition retailers. She fought in court on behalf of children and families on issues including children in foster care, children with disabilities, and tenant protection. New Yorkers overwhelmingly elected Tish James to a second term as public advocate in November 2017. In her career as an attorney and as an elected official, AG James has also fought for tenants' rights, environmental protection, consumer protection, criminal justice reform, and just about every progressive issue on the list. So thank you, AG James, for your leadership. Freda Levenson is the legal director for the ACLU of Ohio and is currently overseeing the response to Ohio's abortion restrictions during the coronavirus pandemic. Freda conducts litigation, manages the legal team, and performs legal analysis of emerging civil liberties issues. Freda has litigated several major cases for the ACLU of Ohio, including in the area of voting rights, challenging the constitutionality of Ohio's gerrymandered congressional map, challenging Ohio's practice of purging infrequent voters, restoring early voter opportunities, protecting minor party ballot access. She also litigates to uphold expressive rights under the First Amendment and successfully challenged restrictions on public expression at Cleveland's Republican National Convention. She is engaged in the ongoing fight to protect reproductive rights in Ohio, bringing cases challenging the so-called heartbeat bill, the fetal anomaly abortion ban, and others. So it is a pleasure and a privilege. Thank you both again for being here, and let's get right into it. I know that the Attorney General is going to start with a few comments.
So first, Shabbat Shalom. I want to thank Amanda and Freda Levenson for giving me this opportunity to participate in this important discussion at this critical juncture. I'm sort of out of breath. I was just on my stoop applauding the first responders, my 7 o'clock applause. Yes. And I also want to thank all of you for joining us, especially at this time when so much of our attention, unfortunately, is focused on tackling the coronavirus pandemic. But the fight for civil rights and for human dignity and gender equality is not a sidebar in the midst of this crisis. In fact, what we are seeing are the fault lines in the aftermath of this corona pandemic, the fault lines along race, gender, and economics. In fact, there are those who would use this pandemic as an excuse to launch a full-on support assault on reproductive freedom and deny women their reproductive and constitutional rights. We are here today to say that will not happen. We have got to stand up and fight back on behalf of women, and particularly women without any voice. Even before the onset of the pandemic, we were experiencing the most aggressive and coordinated attack on reproductive rights since the passage of Roe versus Wade. We've seen a number of conservative states attempt to chip away at Roe versus Wade. And since taking office, this administration has been baseless and has engaged in action in an attempt to restrict our rights and to treat us like second-class citizens. They are trying to dictate what women can and cannot do with their bodies. And they are trying to attack the facilities that provide so many with critical care and support, and all of the healthcare professionals who service women each and every day. But it's important that all of us stand up and fight back. As you may know, I am leading 2 coalitions challenging Texas and Oklahoma's abortion ban during the COVID-19 pandemic. Unfortunately, Texas and Oklahoma are not alone. The states of Alabama, Iowa, Mississippi, and Ohio also implemented similar orders banning abortions during the COVID-19 pandemic, deeming them non-essential. Neither Texas or Oklahoma nor any other state has the right to use the coronavirus as an excuse to restrict a woman's constitutional right to access an abortion. This is clearly an effort to circumvent Supreme Court precedent of nearly 50 years. It's important that we know that there is no emergency carve out in Roe versus Wade. We are also pushing this administration to make access to abortion coverage less burdensome as we battle the coronavirus by making the medical abortion prescription drug known as mifepristone, I hope I said that correctly, more easily accessible. I just call it the abortion pill. The bottom line is this: access to health care is a basic human right, and women have a constitutional right to safe, accessible abortion services, and no person, political party, or government, and or any president can legally deny that right. My office has also spoken out forcefully on the need to protect women from the increased threats of domestic violence in this time of social isolation. I've seen more and more individuals, and particularly women, who are suffering from anxiety and fear. And with the pandemic forcing society to stay primarily in their homes, it is understandable that victims of domestic violence are feeling particularly vulnerable at this time, at a time when they are forced to stay at home with their abuser. As we take extraordinary steps to confront the threat to public health posed by this government, we must not lose sight of the real potential for an increase in intimate partner abuse. Anyone who feels threatened by domestic violence during these difficult times should seek help and guidance from trusted resources. I've always made the fight for women's right and gender equality one of my highest priorities. This is about freedom, and this is about what Margaret Sanger once said: no woman can call herself free who does not control her own body. And I'm proud to stand with Zionists, women around the world, and all of you in our fight for freedom, not only here in New York, but across the globe. So I want to thank you, Amanda. I want to thank you, Freda. I want to thank Rabbi Denziger for including me in this conversation. And I want to leave you with a 2-part call to action. First, we have to reach out to our legislators in our respective states and demand money for human services and small businesses in the next stimulus bill. Let your representatives know that we believe that abortion and reproductive services is an essential service. And second, as we continue to tackle this pandemic, We need to support charities and mutual aid groups that are using volunteers to process requests for help. If you can, it's important that we shop for someone who is vulnerable, a senior citizen, someone who is homebound, someone who is socially isolated. It's important that individuals who are feeling depressed, anxiety, or solemn at this point in time, that they reach out and get professional help. Remember that victims of domestic violence should know that there are resources available to them, and that love should not hurt. Know that you are not alone in all of this. I believe if we continue to follow the safe guidelines such as social distancing, wearing masks, and washing our hands, that we will get through this together, and we will come out on the other side stronger than ever before. I think it's important, again, to end with the belief and knowing that this too shall pass. Thank you so much, and Shabbat Shalom.
Shabbat Shalom. Freda, please tell us what you are doing to protect women in Ohio.
Sure. Thank you so much. Thank you, Amanda, and greetings and good Shabbat to Rabbi Lindsay, to Attorney General Tisch, and to the Zionesses out there participating tonight. I have to say that the right to abortion is under assault in Ohio. It has been even before the emergence of COVID-19. Even though Roe versus Wade remains the law of the land, in Ohio, we live under just about every kind of restriction invented by, I would say invented by man, women too, every kind of restriction imaginable within the confines of Roe versus Wade, everything that can be done to restrict and make more out of reach and expensive the right to reproductive health care, to close clinics and make it harder for women to access this care. We're at the ACLU of Ohio, we're currently engaged in litigation against several more recently enacted ones, but we have a host of others. Right now, we're in court fighting against the so-called heartbeat bill, which is on its face, it's called a bill that criminalizes abortion if the fetal heartbeat is detected. But as you may know, even embryonic tissue creates a detectable, electrically detectable proto-heartbeat as early as 6 weeks. So the ban is effectively a 6-week abortion ban. And most women don't even realize they're pregnant at 6 weeks. The length of a pregnancy is measured from the last menstrual period. So if you're pregnant for 6 weeks, this means your period's 2 weeks late. It could be that your period's irregular. You could have spotty bleeding. You could suffer from a medical condition that where your periods are irregular, or you bleed irregularly. There's all kinds of reasons women, particularly if they're not trying to get pregnant, don't know when their period's 2 weeks late that they're pregnant, and it's also too late to get an abortion by that point. So it's really a total abortion ban. We're fighting that. We're also fighting a recently enacted, well, a couple of years ago, but we're still fighting it, what's called the Down syndrome abortion ban. This is a ban that masquerades as a non-discrimination law, supposedly to protect against discrimination against people with Down syndrome, but it uses people with Down syndrome as pawns in a war against reproductive rights. Even disability rights organizations resent the fact that women are denied the autonomy to make their own decisions over their own reproduction, just as people with disabilities have been denied their autonomy over the years. It's kind of cruelly ironic. And we're also litigating against written transfer agreements, which regulate abortion clinics much more harshly than other ambulatory surgical facilities. It treats them as if they're somehow doing more dangerous or different surgery than other kinds of surgical locations that really do perform riskier, much riskier types of procedures. Again, it's just a brazen way to try to close abortion clinics. And this host of laws has effectively closed most of Ohio's clinics. We only have 6 left in the entire state, down from closer to 20 just several years ago. Already embedded in our law in Ohio are scores of other abortion restrictions. Public insurance coverage isn't available for abortions. Mandatory delays exist. A person needing an abortion needs to make 2 visits to a provider 24 hours apart. So a working woman, a woman with children, a woman who has to drive a long distance, because again, our clinics are scattered throughout the state, has to really take 2 days off to do a procedure that doesn't require that much time. Just one more burden. Biased counseling is required in Ohio. A person who wishes to obtain an abortion is required to be offered the chance to listen to or watch the fetal heartbeat before she can have the procedure. It's cruel and unnecessary and manipulative. Parental consent is needed for a minor who wishes to obtain an abortion in Ohio, and more. This is a partial list. But now with COVID-19, we have just been hit with, as Tish just told you, the latest and possibly the most hypocritical of assaults. The purported reason of the most recent assault is to preserve personal protective equipment, which admittedly is in short supply, and doctors and nurses and other first responders need personal protective equipment. But in fact, hypocritically and ironically, the restriction imposed by Ohio increases the need for personal protective equipment. The Ohio Director of Public Health issued an order, as in many other states, prohibiting all elective surgery. Even prior to this order, Ohio's abortion clinics had changed their practices to do their part to flatten the curve and to preserve personal protective equipment. What they did, our clients, the abortion clinics, canceled all non-urgent visits. You can't get a pap smear these days. You can't go in for other kinds of well and even kind of well visits. They canceled all of them. They put in protocols for social distancing. For instance, people usually can bring a companion with them for support when they receive an abortion, but no longer unless they're a minor or unless they're going to receive anesthesia. It requires, the clinics require patients to wait in their cars until they can come in and be in the facility rather than waiting in the waiting room to try to preserve social distancing. And further, the clinics are providing medical rather than surgical abortions whenever medically appropriate. Medical abortion is an abortion which is done with, is medication assisted. It's a series of pills. As Tish mentioned, mifepristone is one typical one, where a pill is taken and over a period, 2 pills are taken over a period of time to precipitate the abortion. A surgical abortion is really a misnomer because it's not surgery. There's no incision involved. Early abortions are simply vacuum aspiration. But these abortions, the so-called surgical abortions, are not being offered unless they're medically appropriate now. So as a result of these changes in practices to try to preserve PPE and flatten the curve, the rate of surgical abortions has dropped precipitously. We're down to approximately 60% of what it had been before the COVID pandemic. But the state interpreted the medical director's order that says no non-essential medical procedures, no elective procedures. The state took the position that any abortion surgery is elective, and that abortions need to wait up until the point that they become illegal in Ohio. In other words, patients need to wait and remain pregnant until this cusp, which is 20.6 weeks last menstrual period, before they can obtain an abortion. This is a completely flawed approach. It requires women to remain pregnant much longer than they would if they could get an abortion at the time they need it. And we can talk about some of these ramifications as we go on further into this program. But I just want to emphasize here that abortion is essential, and it's obviously time-sensitive health care. It is not elective.
Okay, so let's delve a bit deeper. So this is for both of you. Some of the questions are just for one of you, some of them, whoever wants to take it. As Freda has already touched on, we've all been hearing about the assault on women's rights intensifying with the outbreak of COVID-19. And as the Attorney General mentioned, there are several states, in particular Texas, Ohio, Mississippi, Alabama, Oklahoma, that have issued these executive orders. So, well, actually, we really already addressed how the ACLU and really the state of New York, I think our state of New York is obviously does not have an executive order like this. And actually, there was a law passed last year which recognizes abortion as a fundamental right. So maybe AG James, if you could touch on that, if there are any further efforts. I know there's not much further to go other than codifying it, in the event that there were to be rollbacks on Roe v. Wade. But do you know if any other states? I know this happened in Virginia. Last week, the Virginia governor signed a similar bill into law. Do you know of any other efforts? And do you know of any issues in have any issues in New York arisen where, women are not able to get the care that they need?
So as part of the governor's, one of the executive orders, the governor of the state of New York, Governor Cuomo, specifically indicated that abortion is an essential service. And so we are protecting a woman's right to receive abortions and reproductive services in the state of New York. However, in the past, prior to this pandemic, we have had to challenge a number of these clinics, these right to life clinics that are popping up, who are presenting themselves as abortion clinics when in fact they are not. They are very pro-life. And we've had to stand up and defend women in the state of New York against these zealots, if you will, who unfortunately will not respect barriers around reproductive facilities in the state of New York. And we have been successful at, again, defending Roe versus Wade and defending a woman's right to privacy and a woman's right to do what she deems necessary and a personal decision with her own body.
Thank you. So these cases are the ones that, in the states that we just mentioned, are being heard by circuit courts across the country. And the bans are largely being overturned, meaning when legislatures or governors say that they want to institute an abortion ban during the pandemic, the courts are saying no. This, especially the abortions with the pill as opposed to the surgical abortions. And I know Freda can talk more about whether they're really surgical, whether that's the right word, but the courts are saying, no, you can't deny women this right, mostly. But there is palpable fear among repro rights activists and women that the new composition of the Supreme Court could be a problem if a case like this, or a case that is intentionally created to challenge Roe v. Wade, made its way there. So I'm curious if either of you are worried. I know there is a fear, but are you legitimate? You are the expert. So is the fear legitimate? about a rollback of Roe, either, with one of these cases getting to the Supreme Court, or the Louisiana case, for example, that was heard, oral argument was heard about a month ago, feels like 7 lifetimes ago at this point. But yeah, whichever of you.
Well, I'm sure we're both very worried, and as everyone should be. I can speak particularly about Ohio, that our legislature is increasingly emboldened. So is that in other states. Ohio and other states are increasingly passing restrictions that they know are unconstitutional, that don't pass constitutional muster under Roe versus Wade. They're doing this knowing they will likely lose in the trial courts, and they are. So far, every time they have. But they're betting that one of these cases, one of these days, is going to provide them with a vehicle to go up to the Supreme Court and have, as Amanda, you said, this newly composed court with a new balance, without Kennedy as the pivot anymore.
Greta? She's frozen.
Argued.
She's back. You froze for a little while.
Oh, I'm sorry.
That's okay.
Am I back?
You were just getting to a new balance without Kennedy.
Oh, okay. Thank you. Yeah, we're very worried that with a differently composed court, they're ideologically shifted, and they could take the exact same case and come out with a different conclusion. And in many ways, the case that they just heard is very similar to the case that was determined not too long ago, the Texas case, which is another written transfer agreement. And we may have the opposite conclusion. So we're worried that Roe versus Wade could be totally reversed, or else very seriously eviscerated, death by several cuts, as is happening to reproductive freedom in Ohio. Even in cases being litigated in the lower courts, the state is being very, very aggressive and taking bold moves that they never would have taken before. For instance, in our Down syndrome abortion case, we won in the trial. The state appealed to the Sixth Circuit. We won in the Sixth Circuit. And normally at that point, they would rest. But what they did was they pulled an unusual move called moving for en banc, which is very rare, exceedingly rare. And it's rare for an en banc petition to be granted. It means for the entire circuit, every judge sitting on the circuit, to rehear the case. It's even rarer for the court to grant the petition. And in this case, our newly conservative Sixth Circuit granted it because, as you know, our President Trump is very aggressively appointing judges to fill vacancies in all the federal court positions. And our Sixth Circuit here in Ohio and Michigan and Kentucky, the cases into the Sixth Circuit now have 6 Trump appointees out of 16 active judges. So there's a new movement to try to push cases there too, in the to en banc hearings, not just to the Supreme Court. They're really pulling out all the stops and litigating just as playing as much hardball as they can to push these cases to unfavorable resolutions.
I was my office and myself, we were pleasantly surprised that the Fifth Circuit, which tends to be a very conservative court, modified its own stay, and medical abortions will be permitted in Texas. I must admit, I was surprised. I was concerned that case would reach the Supreme Court, and I'm not sure of I don't know what the outcome would have been, but as you know, it leans right. And I was just as surprised with the 10th Circuit that refused to disturb the stay imposed by the District Court in Oklahoma, another conservative court. But I think it's important that all of the listeners understand how important it is. There's been recent discussions as late as this morning, where the President of the United States would like for the Congress to be in recess, so that he could appoint conservative judges. He has that power. And so, the House, they go in, they gavel. They're presumably doing work. He says, the president, says they should be in recess. And the reason why he would like for the both houses, the Congress, to be in recess is because he wants to fill these vacancies. And he's appointing all of these anti-choice judges, who, by the way, are men. And a lot of them have little, if no experience, and they're very, very, very young. He poses a existential threat to our freedom and to our liberties as women, and to our privacy. And so not only tonight should we talk a little bit about reproductive rights, but we got to talk about activism and what's at stake on the ballot. And I would argue that democracy is on the ballot, my friends.
That's a perfect opportunity for us to plug another webinar we're doing on Thursday of next week with Bakari Sellers on exactly this topic of how to protect our institutions, democracy, the vote. These are things, it's crazy. I know my mom is on right now and we talk about this a lot, and it's hard for me to talk about. I mean, she's constantly, reminding me, and I'm like, I can't think about the fact that democracy is on the ballot, as you said, A.G. James, but it is. And we all have to figure out how we're going to protect it and save it.
I mean,
sorry, go ahead.
Yeah, just given this pandemic and the lack of leadership, and the indecision and the conflicting messages and how we were late to respond. If anything, that should demonstrate how important it is to have someone who understands the role of presidency, and how we just need someone with not only a moral fiber, but someone who can lead, and someone who's intelligent, and and someone who understands what's at stake. Sorry.
But it's okay. No, I just have to quickly say Zioness is a 501c3, so we can't endorse or oppose candidates.
No, I understand.
That was Tish James, not Zioness. Then elected, she can say whatever she wants.
Blame it on me. Blame it on me.
Also, the Attorney General's office is responsible for nonprofits in the state of New York, so I hope I'm okay.
Tish James, the private citizen, speaking her mind out of frustration, and because she's been locked in this house.
And also, I think we're talking really about ideology rather than political parties. This is really an ideological thing. Democracy is nonpartisan, or it's supposed to be. It's not an issue of partisanship. I just wanted to be clear, speaking on behalf of Zioness myself, that we don't oppose or endorse candidates for public office. Having said that, there are issues everyone should be thinking about. If you care about reproductive health and reproductive freedom, you should be thinking about who represents those values, and you should be thinking about how you can be most active in protecting them. If you care about health, if you care about, any of the communities that are being, so heavily impacted by this virus, and it's the same communities that are impacted without the virus. The people who are facing the biggest challenges today are facing, are the same people that were facing disproportionate challenges before this. It's just a new level. And we all have a lot of work to do. And so that's why we want
and denying women reproductive rights. I've got to say, this disproportionately affects low-income women and people of color.
Well, so that's my next question for you, actually, because we're actually closing right now Black Maternal Health Week. So I wanted to ask you to reflect a little bit on that, and on the fact that, reproductive access, of course, is critically important for communities of color and for poor communities, because, Freda and I were talking about this yesterday. If a state like Mississippi were to close all of its abortion providers, and people there who didn't have the resources to cross state borders to find an abortion provider, would then be forced to have a child that they didn't feel that they, had the support, emotionally, economically, physically, or, for whatever other reason a woman decided to make a decision about her body, so just all of these issues, you just brought it up, but let's talk a little bit about how much it matters that we be protecting the most marginalized.
Right. This pandemic, again, is revealing fault lines.
Yeah.
And the vast majority of individuals who have lost their lives are low-income individuals and people of color. Most women of color and most low-income women don't have the benefit of just packing up and going to another state to have an abortion. It's just not available. And particularly now where they have lost their access to, to income and or to benefits. And so it's important that individuals understand what will then happen. They could resort depending on getting an abortion through illegal means, going through back alleys, and resorting to other efforts. And so it's really critically important that individuals understand who is going to be adversely impacted by this assault on women. As a former city council member, before I was public advocate and attorney general, I was a city council member in Brooklyn. I still live in that district. And young girls, minors, would come to my office, and minors who could not confide in their parents and who wanted to talk to a big sister, and I was their big sister. And invariably, I would always take them to Planned Parenthood where they could get abortion, and it was a non-judgmental space, and they appreciated it. Most of these women, the majority of these young ladies, I can say have proudly graduated from college. Some are lawyers, some are doctors, some are teachers. The bottom line is that they took control of their bodies, and that was really critically important. It's the vast majority of abortions in this country are medical abortions. And so what we need to do is remove the barriers to medical abortions. Right now, if you want access to a medical abortion, you've got to you have to physically show up to a clinic. You have to sign a form, and then you have to have consultation, as opposed to remaining in your home during this pandemic, doing teleconferencing with a doctor, and having the prescription mailed to your pharmacy. So there are restrictions, and this is nothing more than another barrier for abortion. It's also important to know that most abortions are not performed in hospitals and do not require PPE, because most abortions, as I mentioned, are medical abortions. And so using PPE as an excuse and saying somehow women are going to occupy space at hospitals is a lie. And it's nothing more than excuse. And so it's important, one, that the disproportionate impact on women of color and low-income people. Two, the argument that somehow we're accessing PPE at a time when it's needed, and or hospital rooms when they're needed during this pandemic is not true at all. If individuals were really, really, really supportive of reproductive rights and access to abortion, what they would do is remove the barriers to medical abortions, and join with me, obviously, in promoting more teleconferences, so that individuals can get the health care that they need and are entitled to.
I agree with you very much, Tish, that the hypocrisy of these COVID abortion restrictions is revealed, particularly in the suppression of the opportunity to do telemedicine, to do socially distanced pill prescription, which would make so much sense. If the state were sincere in wanting to preserve personal protective equipment and wanting to flatten the curve, they would make that possible. Also in Ohio, with its hypocritical rules, Ohio even arbitrarily limits the use of medication-assisted abortions. These pills, Miffy, can be safely used, and in other states are used up until 11 weeks of pregnancy. But in Ohio, it's limited to 10 weeks. So Ohio itself is requiring additional surgical abortions and additional personal encounters with other people, that it doesn't need to do that if it were sincere about saving PPE and flattening the curve. Pregnancy itself, by putting off pregnancies, abortions until late in a pregnancy, is of course uses more PPE, personal protective equipment. Pregnancy itself is a risk factor. Pregnant person contracts COVID-19. It's one of the main risk factors. So to require a person to be exposed to grave illness is counter intelligence. It's against good public health. And it reveals that this is actually a thinly veiled attempt to close abortion clinics and to put abortion out of reach. Also, I have to say, I agree with you very much about that we have to look at the intersectionality of reproductive justice with racial and economic justice. Because when abortion is no longer available in some states, and we know which states these are, it includes Ohio, that means it will travel to places where abortion is available will be a possibility only for women of means. And so poor women of color will be disproportionately and cruelly impacted by this.
And let me also say that, we are witnessing in our nation now the feminization of poverty. And the feminization of poverty is disproportionately affecting, again, low-income women and women of color. And the intersectionality of poverty and the lack of access to healthcare, we are seeing that as a result of this pandemic. The disparities in testing is an issue that I am dealing with, not only in New York State, but all across this nation. And so the fault lines are real, and the lack of access to abortion is inextricably tied to the structural racism that we are witnessing and seeing during this pandemic, unfortunately.
Can I just quickly ask one of you, either one, to define medical abortion versus surgical abortion, just for anyone who's watching who doesn't know the difference?
Yeah, really quickly, a medication-assisted abortion is an abortion that is precipitated by pills. As Tish said, it's Miffy is the nickname for the commonly prescribed pill. And it's taken twice, and the woman does not need to go to the facility unless there's complications. A surgical abortion, again, there's no incision, but it's called surgical because it's a procedure, and it usually involves just aspiration. Although at a later stage in pregnancy, it's a more complicated process that involves the dilation and then the scraping of the uterine contents. So it's more involved, takes more time, and it involves more of this personal protective equipment that we're trying to conserve.
Thank you. I just wanted to make sure everybody knew what those terms meant. So for both of you, I've been thinking a lot about, and we did a webinar yesterday with Congresswoman Lois Franklin. I asked her this question too. I'm very interested in your thoughts. I'm sure they'll be consistent with hers. But I've been thinking about how perverse it is that in a lot of states, both liquor stores and gun shops have been deemed to be essential services, but women's health services are not essential. And of course, domestic abuse is on the rise. Like I've never seen in my lifetime these numbers. In Europe, it was something like 30% increase in domestic violence, intimate partner abuse. The governments of Italy and Spain have been requisitioning hotels to use as shelters for abused women because they don't have anywhere else to go. how is this a reality that, gun shops and liquor stores, and listen, I got my Shabbat wine. I'm not complaining about the fact that I could buy, some vino to handle this situation that we're all in, but the danger that this is that women are facing as a result of what businesses actually are deemed essential, and then on top of it, the fact that women's health is not deemed essential. How do we respond to that? I mean, AG James, how are we handling domestic abuse in New York? And then if you have any recommendations for what Zionists, we have people watching from across the country, for what people can do in terms of seeing signs in friends and family who they think may be, facing abuse. How do we recognize it? What do we do to help, if we do have a fear that something like that is happening? For those of us who are safe in our homes, what do we do for people who are stuck in their homes?
So in New York, gun stores are non-essential.
Yes.
But in fact, some have opened. We've issued cease and desist orders. And most recently, we were sued by the NRA and some gun stores, and we're currently in court arguing that gun stores are non-essential. Now, liquor stores are essential. I don't know how you reconcile that. I guess we need happy juice. I don't know, but they are. Or alternatively, they've got a very powerful lobbyist. So, but it is what it is. Tonight, I forgot to mention that we filed a brief in the 8th Circuit regarding an abortion ban, a pre-viable abortion ban in Arkansas, except in the case of necessary, except in a case where it was necessary to save the life of the mom. So we, again, filed an amicus, we filed in a brief. The district court has stayed the ban, but Arkansas, of course, has appealed, and we support the opposition to the appeal, and we join with the ACLU and Planned Parenthood of Arkansas, and we hope that we could knock down that ban. For individuals who unfortunately are struggling and dealing with domestic violence, it is on the increase across our nation, including here in New York. And so we have issued, working with the district attorneys in the state of New York, have basically issued some helpful hints. And we have urged women to try to identify some signals and to reach out to friends and allies who can assist them at a time of need. No woman should be forced to live with her batterer and be abused in close quarters or in any quarters during this point in time. There are resources. We have reserved some hotel rooms available for domestic violence victims and or survivors, as I would like to call them. We are also setting aside rooms in hotels for the homeless at this time to protect them from the coronavirus. It's important that we think about others at this point and that we all recognize that we're in this together, and that the fact that we are separated physically should not mean that we are separated emotionally, mentally, and otherwise, and that we still have an obligation and a duty to think about others before we think about ourselves, and that this really is an attempt to protect or to recognize the humanity of all of us. But domestic violence is on the increase. Our courts, we've been working with our courts here in New York, and our courts, even though they are physically closed, they are still operational, and victims of domestic violence and or survivors can have access to orders of protection, and our criminal courts are open as well for individuals, if necessary, if they have to be removed from the premises and or arrested. It's important that women understand that at this time, they are not alone, women and or men, but a disproportionate number of the survivors are women. You're not alone. We're here for you.
Thank you. Freda, as we mentioned earlier, Virginia last week joined a cohort of states with bipartisan leadership, actually. Interestingly, the governor of Vermont, who is Republican, last year codified abortion protections, recognizing reproductive choice as a fundamental right. we know that states like Alabama and Georgia have been passing very restrictive abortion laws in an attempt to push a case up to the Supreme Court. And we touched on this already, but if you could just tell us, specifically what you think the world will look like if we go back to a pre-Roe reality. And, we did talk about, lower income individuals not being able to cross state lines, but what will happen, if Roe is either overturned or as you mentioned earlier, death by cuts?
Yeah, that's unfortunately a really important question. It would have been speculation just years ago, but now we really have to think about this. Yeah. Most of us have come of age or perhaps lived our whole lives in the post-Roe world. I was a college senior when Roe was decided. You two were probably born into a world where Roe was already the law. Many women have grown up with this freedom existing. But at the time that it was passed, the decision was made, who would think that 47 years later, the world would start to go back into the dark old days? But that's where we're headed. Things are turning retrograde. Together with partner organizations and providers, and other advocates, we, ACLU, are actively planning for a world where we do go dark, where the light goes off in the last Ohio clinic. We have to seriously consider and plan for that contingency now. It would be irresponsible not to think about it. Most planning of necessity is confidential, but the scenario will basically be that abortion clinics in Ohio and states like Ohio will have to turn into travel agencies. Women of means will still be able to travel to the less benighted states and receive their necessary health care. Attorney General Tisch, we may be traveling to New York. More typically, women in Ohio can look to Chicago, depending on what part of the state they live. But poor women, again, women of color, will not be able to do this. We will see tragedy. We're going to see self-induced abortions. In the course of thinking about this, I've spoken to many older docs who saw tragic results of this way back when they were young, at the early stage of their career, when they were new physicians. And hearing the stories of the things they saw would make you sick and profoundly sad. But that's where we're going.
So this is not apocalyptic, right? For those of us who are really afraid, we're not being dramatic. This could happen soon.
This could happen. The emotion that you hear in her voice is real. It could happen. And so we've got to get ready and we've got a plan. I hearken back to the days where there was an underground network, and that's what we're going to have to create. Underground networks, regions where we work with one another, safe harbor houses, and we're going to have to use technology a lot. And we're going to have to, again, provide these these pills, abortion pills, to women all over our country. But I think we're going to have to engage in some real and honest discussions about what our country will look like when democracy goes dark. We've been living in really regressive days and times. The regressive policies of this administration against women, immigrants, low-income people, people of color, every group that you could possibly think of, he's attacked. And so now it's an opportunity to join together and form coalitions and to stand up and to protect the rights of all individuals. There's been attacks on the environment. My office has filed more lawsuits against this administration protecting the environment. So I just need environmentalists, I need activists, I need women, I need immigrants, people of color, Black, white, Latino, Jewish, Asian. All of us must stand together and demand decency and accountability and transparency and a government that we can be proud of. And that's nonpartisan.
Clarify one thing that maybe some lawyers don't understand. It's maybe one beacon of some hope here, at least with regard to Roe versus Wade and reproductive rights. If the Supreme Court reverses Roe versus Wade, what it would mean is that states individually have the power to ban abortion. The Supreme Court doesn't have the power to ban abortion across America. It will only, I shouldn't say just only, as if they were trivial, but abortion would, states that were able then to ban abortions would, states that wanted to continue to keep it legal would continue to permit it. So there would be a patchwork of laws across the country.
That's, and she's absolutely right. And what we are seeing right now, and I can't believe that I am saying it, a woman of color, that I am defending states' rights. States' rights in the 21st century, of course, but states' rights nonetheless. And so we are protecting, my responsibility is to protect the sovereign rights of New York State each and every day and to defend the 10th Amendment of our Constitution. And that's what you will see, a patchwork of states that will offer and provide access to abortion, and then there are those who will not, just like those who unfortunately tonight do not have a stay-at-home order in place in their state, and the pandemic is ravaging their state, and they want to turn a blind eye to it.
Right. So we're almost out of time, and AG James, Sophie Neer is watching with her family, and she told me that I cannot make this so depressing without bringing any fun, joyful stories when people are stuck at home and we're talking about, overturning Roe, and we need to have some fun stories. So her favorite story, and I have to say it's one of my favorite stories of yours also, is when you were in Israel and you were mistaken for another public figure. And I thought people just might enjoy and have a nice laugh because you tell the story with such joy.
So
if you don't mind.
Sophie, how are you? So I went to Israel, and as a former city council member, I represented Crown Heights, and I still represent Crown Heights. And so I'm honorary Lubavitch to a certain extent. And for 10 years, I represented that community, and they are near and dear to my heart. So I went to Israel, and on the streets of Israel, people from Crown Heights were like, hey, Tish, hey, Tish, hey, Tish. But then we went into a bar, of course, at Sophie's suggestion. We went into a bar one night, and someone turned around and said, Oprah Winfrey is here. And I, of course, in my, immediate Oprah Winfrey moment said, yes, I am here. Oprah Winfrey, that's me. May I interview you? And the whole crowd, they were like, oh my God. So for one night, I sort of got what I experienced being Oprah Winfrey in Israel. It was fabulous.
Well, it's less, since we have less of a crowd. Everyone's laughing at home, but even since we have less of a crowd to laugh here, it was such a funny story. I heard you tell it last year at an event, and everyone was hysterically laughing. You said you walked in, you had a security detail, of course, and
Exactly.
people, were just like, it must be Oprah.
It is, yeah. I told them to protect me. It was Oprah. I was looking for Stedman, but he was nowhere around.
So funny. Okay, so the last thing I really would love if first of all, I want to reiterate my gratitude to both of you for joining us. It's such an important conversation. People need to be enlightened. People who are not following this issue religiously the way that we are aren't sure exactly what's going on. They know there's some kind of fear happening amongst women and repro rights activists, but they don't know the details of it. And so I hope that this was an opportunity for people to really understand how serious the crisis is, how much it's affecting women in this time of coronavirus, and even beyond coronavirus, how much work we really have to do if we want to protect reproductive health in this country, because it's not, we've been taking it for granted. I was born into a world where it existed, and I never realized until recently that it was possible to live in a world where it didn't. So I'm grateful, first of all, for any specific takeaways that either of you can provide for actions people should be taking, organizations they should be following, messages they should be sharing. We're stuck at home or we're safe at home, but how can we share messages on social media? Do you have any specific ways that people can take action and feel like they have agency?
Well, thank you for the chance to say this, Amanda. I don't mean to be crass, but we need funds to fight these battles. The ACLU and organizations like Planned Parenthood, until recently, really actually benefited from the Trump bump, starting with the Muslim ban. Every time the president would issue a new executive order, our skyrocket to a new level. And, we use these funds to increase our legal operation because, the government is the biggest law firm that there is. And it's this, David fighting Goliath, and this, equalized didn't equalize, but came, closer towards providing the power that we needed. But now, of course, with many of our donors' portfolios really seriously diminished by the impact of the COVID pandemic, we've already seen a drop in contributions, and we project a 30% drop in our giving this year. So your audience might consider, and this isn't just plug for send your money to the ACLU, but any organization that you care about that is fighting the good fight to advocate for the justice and ideals that you believe in. They're particularly needy at this time. Also, with respect to ACLU, but probably other organizations as well, you could look for their websites. Look for your state's ACLU affiliate website. You can sign up there for action alerts that will give you easy methods of contacting government officials at critical inflection points, and also supply you with information about ongoing issues.
So first, register to vote. Register to vote. Register to vote. 2, fill out the census, because the census is tied to reapportionment, and it's tied to resources that states desperately need. Tell your legislators, your Congress member, your state elected officials that you believe abortion is health care and it should be considered an essential service, because it is essential, and it's really critically important that women have agency, yes, but also that we respect a woman's right to choose. Second, support Planned Parenthood at ACLU, support charities, mutual aid groups, support Zionists, and just think about others. Think about those who are socially isolated, those who are homebound right now. Think about those who are depressed, those who are sullen, those who might be mentally ill, those who are suffering from anxiety. Get them assistance, give them a call, check on them, tell them a joke. And since this is a Shabbat service, pray for our nation, pray for our state, pray for our city, pray for your family, and pray that, and know that we're going to be stronger when we come out of this together.
Thank you. Okay, so the last thing, really, I know I said that on the last one, but I just want to say that you're both such incredible leaders and doing such important work. And we all owe you a profound thanks. And before we go to Rabbi Lindsay for the Shabbat candle lighting, I was just hoping you could reflect briefly on being a Zionist, someone who's deeply committed to the advancement of the progressive agenda in America, who's also unwavering in their support of Israel as the Jewish state and the Jewish homeland. And the reason that I'm asking this question is because it's not always easy to show up in social justice spaces as a proud Zionist, and so many Jews are feeling alienated from those spaces because of it. So for all of our activists who are watching, for anyone who has either been staying home from progressive activism, I know we're all staying home now, but once we get to the other side of this and we want to be activists on all of these justice issues that we've talked about, it means the world to see trailblazing leaders like the two of you who are not afraid, not ashamed of who you are, and your commitment also to Jewish liberation and Zionism. So I just think it would mean a lot to people watching for you to reflect on that.
I really want to thank you, Amanda, for this incredible opportunity to share information to such a passionate and incredible group tonight. I can't see them, but I've seen occasional comments pop up, and they've been really intelligent and loving and engaged. And so I really feel a connection to this group just through that, and such an appreciation of your thorough preparation and questioning, that you've obviously looked so deeply into this area yourself, and that commitment to educating yourself and understanding the issues and then bringing people in to talk about it is just huge. And it's such a credit to this organization. And I just really want to thank all of you for your commitment to justice. I commend you for your interest in activism, to Tish, to Rabbi Lindsay, to all of you. Thank you. I wish you peace, good health and safety during these really trying times. And I wish everyone a good Shabbat.
I too wish everyone a good Shabbat as well. And I know that we will get through this crisis and we will come out stronger on the other side. But I also know, to quote the phrase of a famous elected official, it's really going to be up to women. And so let us all join together, and let us take responsibility and agency for one another. And let's make a difference in the life of those whose voices cannot be heard tonight, those who are locked out of the sunshine of opportunity, and those who depend upon you and I to put up a good fight and defend their rights. Let's do that together. I thank you, Amanda, for this amazing opportunity. Shabbat Shalom.
Thank you. So I'm just bringing Rabbi Lindsay Danziger, Freda, and A.G. James. I know you have things to do, but if you would like to join for our Shabbat prayers and candlelighting, it would be an honor. A.G. James, I know you are a woman of faith who also loves Jewish tradition and is honorary Lubavitch. So yes. I would love to light Shabbat candles with you. And please take it away, Lindsay.
Thank you so much. First of all, thank you so much to Amanda, to Attorney General James, to Freda, and Shabbat Shalom to each of you. I learned so much over the past hour plus, and I'm leaving this conversation personally called to action. And I just want to say we spent the past hour in what I think is really a holy conversation, right? It's extremely important to have these conversations on Shabbat because this is what it means to live Jewish values. And we heard some very powerful and some very heavy words tonight. It's sticking with me, the words that democracy is on the ballot this November. And also the phrase, democracy might go dark. There's a time on the horizon where we might see democracy go dark. Those are some phrases from tonight that I'm going to be carrying into this Shabbat I'm really thinking about. And I also want to add that we heard some words of hope. We heard that we have power. Each of us has power. we heard that we need each other and that we actually can band together and make a difference. So glad to be bringing some of that hope and inspiration into my Shabbat practice as we enter Shabbat also. So now I'm really privileged that I'm going to transition us into a different kind of holy time together. And as we move into our Shabbat portion of the evening, I want to just take a brief moment before we light our candles and share a reflection about something that's been on my mind a lot regarding what it means to have Shabbat during this moment of COVID-19. So there is a Jewish mystical teaching called Tzimtzum, and this means contraction. It means that we have a God who is all powerful and present everywhere. And there shouldn't really be any room for humans to do anything if God was taking up all the space that was possible. So God actually contracts, shrinks a little to be a little less present, a little less powerful. And this contraction makes room for us so that we can be human and create and make decisions, make mistakes, and do all these messy things that are part of life. So even in contracting, God is actually moving life forward. So why am I talking about tzimtzum or contraction? Because Shabbat is a weekly contraction of our normal routine. And many of us are used to spending our weekdays constantly moving, checking things off of our to-do list. But Shabbat is our chance and also really our challenge to ourselves to say, for one day, I'm going to sit back and just be. I'm going to learn and I'm going to observe. So perhaps you can guess where I'm going with this in relation to the state of the world as we find it right now. We're in this global contraction, really, of so many things, of the economy, some freedom, security, tragically, contraction of health and safety and even life for too many people. Even some of our loved ones probably on this call who we're praying for on this Shabbat. And we are definitely in a contraction of our ability to be productive in the way we're used to. So after our conversation about maternal health, it feels appropriate to also add that even though contraction can be painful, it's also fruitful, right? Contractions are the source of all life. And I can attest from personal experience that contractions are also very painful. So right now, we feel pain. There are so many iniquities in our society that are being laid bare, one of which we really delved into tonight. We know that this virus doesn't discriminate, but the pandemic is disproportionately impacting certain groups of Americans, the Black community, women, working class folks, people who are incarcerated. And it's upon us to both mobilize right now and do what we can to protect the vulnerable, but also hopefully to learn from this time. The pandemic highlights the urgency of addressing systemic inequality. And I'll just end by sharing a beautiful teaching that I heard this week from Sikh activist Valerie Kaur. Maybe some of you have heard this. She has a powerful prayer and a video that's making the rounds online right now. And she said, "You may think you are in the tomb, but you're really in the womb. You may think you're in the tomb, but you're really in the womb. Right now it feels like we're in this dark and narrow and hopeless place. But on this Shabbat, I hope that we can join together in prayer that rather than letting this be a tomb, this moment could actually be more of a womb, that it will give birth to a renewed commitment to heal inequality and create a more just society." So I hope we can hold that wish and that prayer and that intention in our hearts as we now turn to lighting our Shabbat candles and saying our Shabbat blessings. And our candles serve as a symbol of light and hope in the midst of a lot of darkness that we're bringing into this joyous time. So if you're at home, if you have candles, wine, challah, or even if you have none of those, feel free to join in your own homes if you wish.
And I just want to say to everyone watching, after Lindsay, we're going to go right to Jay Cohen for our arugula cooking demo, which we're very
Excellent. A little more sweetness, which I think we all could use. Baruch atah Adonai Eloheinu melech haolam, asher kitshanu b'mitzvotav v'tzivanu Lahadlik ner shel Shabbat. Blessed are you, Adonai, our God, ruler of the universe, who makes us holy with commandments and commands us to kindle the Sabbath lights. Amen.
Amen.
And we now turn to our wine and lift our glasses for a much needed l'chaim and moment of sweetness. Blessed are you, Adonai, our God, ruler of the universe, who creates the fruit of the vine. Baruch atah Adonai, Eloheinu melech haolam, borei pri hagafen. L'chaim.
L'chaim.
And for our motzi, I have my, I'm embarrassed in front of our chef, my mini challah that came frozen in a box today. But you can say motzi over everything. So as we bless our challah, I just invite you to draw to mind what you're grateful for, what you're giving thanks for on this Shabbat, and what does it mean to you that you have enough in this moment. So blessed are you, Adonai, our God, ruler of the universe, who brings forth bread from the earth. Baruch atah Adonai, Eloheinu melech haolam, hamotzi lechem min haaretz. Amen. Shabbat shalom, everyone.
Shabbat shalom, everyone.
Thank you, Attorney General.
Thank you.
Stay safe. We are so grateful for you, and we need your leadership more than ever.
Thank you. Stay safe, everybody.
Okay, let's get Jake. He is here. I just need to switch him. There he is. Jake, you're muted.
Shabbat shalom.
Shabbat shalom.
Better.
Should I do a bio of you?
I mean,
I kind of want to, but I just didn't want to.
I mean,
I didn't know if you wanted it.
Sure.
Okay. Hang on. I still have my challah in my mouth. Okay, this is such a pleasure to have Jake Cohen with us. Thank you so much for doing this. Jake is really an epic chef, and you should all be following him on Instagram at Jake Cohen. His food keeps me up at night. I'm not kidding. When I can't sleep, I look at his Instagram feed and it makes me not sleep more because it makes me so hungry. But I really could not be more thrilled that he is joining us, and we are going to make rugelach. You've all gotten the ingredients list in your registration email. Jake is a nice Jewish boy, so he says, who loves food. He loves food so much that his entire existence, personal and professional, is pretty much centered around cooking and consuming food. He studied at the Culinary Institute of America, during and after which he spent time working the line at New York City restaurant institutions, Danielle and ABC Kitchen. Eventually, he transitioned out of restaurants and into food media, first at Saveur magazine, where he led up recipe tasting in the publication's test kitchen. After Saveur, his career led him to writing and contributing to dozens of incredible food publications, including time serving as the food editor of TastingTable.com, as well as the food critic for Time Out New York. Now Jake is spending his days as the editorial and test kitchen director of The Feed, which you should also be following at The Feed, the largest social media driven food publication. That is pretty incredible. Mazel tov on that. Jake's nights are spent working on his first cookbook, Jew-ish, with a dash between Jew and ish, which is to be published by HMH in spring of 2021, so next spring. If you need a recipe conceived, tested, or developed or styled, you can call Jake. If you need someone to host a culinary video or event, you can call Jake.
All right. Now I put two and together. That's from my website. Yes. No.
Yeah.
You don't have to add that part. But
You should call Jake for all the things and all food related. And then Lindsay and I think do you want me to cook with you, or do you I think you should probably be the full screen, right?
Yeah. I mean, that's totally fine.
Jake's the full screen. All right. Okay, so
Very excited. Hello. So I mean, I picked arugula just because it's easy, and in the sense of I wanted something that we could do and not have to, if people are doing it with me or even want to see it, like it doesn't need a lot of like movie magic in terms of swap outs. So I kind of prepped everything. We'll make it so that you won't even see me that much. So in terms of what we need, I'm doing a half batch just because I already made a half batch to show you what they're going to look like in the end. but we have, according to the recipe, 8 ounces of cream cheese, which is just 1 block, and 1 stick of butter. And once we have that together, we're going to mix it up with some confectioner sugar. This is kind of like a go-to Jewish dessert for me. I grew up in Queens, and it was just one of those very, very kind of ritual things of every year with a family friend, Evelyn Offner, who would come by and drop off like dozens of rugula. And they just were absolutely perfect and became kind of the basis of this recipe in terms of the dough, which is now the dough that's going to be in my book as well for many different rugula variations. So we're just kind of creaming it together. If they're soft, like you see how easy that was, just do it by hand. You can definitely do this in a mixer, but it's just not so necessary. And then I'm going to throw in half teaspoon of salt. And we're going to add in our flour, and that's it. That's the dough. It's like, it's a very, very simple dough. People can kind of think that it seems a little bit trickier than it actually is. It's truly just butter, cream cheese, salt, sugar, flour. So I'm adding in flour. In total, it's 2 1/3 cups for a full recipe. I'm going to start to kind of work it in with my rubber spatula, and then I'll switch to my hands just to kind of knead it together. This is kind of one of those things that in a perfect world, you would make it, you would break it up into discs, you would wrap them up and throw them in the fridge to chill. However, it's a super forgiving dough. So I've completely kind of made the dough and then just gone straight into rolling. So that's why it works perfect for tonight. I have to say thank you, Amanda, and thanks. I mean, I think Sophie's watching, but this was so wonderful. I definitely wasn't expecting my Shabbat to go this way, but it was such a wonderful and thoughtful conversation that really is.
Thank you so much for doing it. And Sophie is watching.
Love it. Okay, so once it starts to look crumbly, kind of like pie dough-ish, that's when I'm going to kind of switch to my hand. And we're just going to start to knead it until it comes together. What we're doing is we're really like hydrating the flour. If you think about anything in that sense of, you don't want to overwork any dough, but at the same point, you want to make sure that every ounce of flour is kind of absorbing all the moisture from the butter and the cream cheese. And that's what's going to make a smooth dough that doesn't crack. Which is another reason why chilling it is great, but at the end of the day, it's totally fine. And this also, the full recipe makes like a lot. It makes 4 dozen rugula, but rugula are small, so I typically consider like, each person's gonna eat at least like 5 or 6 at a time. But when you're doing it, you can also just like take 1 disc and make some rugula and then throw the rest in the fridge. You can even throw some in the freezer and save it for a really, like a rainy day. But this is kind of what we're looking for. It's a nice, it kind of feels like Play-Doh. It's soft, it's smooth, it's not crumbly at all. And since this is a half recipe, I'm just going to divide it into half. For everyone else who's doing a full one, you would divide it into 4. All right, push it into little patties. Get this out of the way. Now we roll. I kind of said in this recipe, it's like to the fillings. The recipe itself is from this kind of feature story I did for Fine Cooking Magazine last year, all on rugula. And it was like all of these modern kind of like fancy fillings and variations, both sweet and savory. And the more I have made rugula, the more I've realized that simple is better. So I just think you have a really great dough, and then I'll give you a few options for fillings. You could use Nutella, you could use jam, you could use peanut butter, you can use pretty much anything that's sweet and thick. You could make like just cinnamon sugar, mix it with butter, that would work too. Whatever you want. But now I'm just going to roll this into a 9-inch circle. The key is you want to make sure it's floured, so I'm moving it with every kind of roll, and then I'm turning it a quarter. keep going. Oh, I guess I could put in the chat in case there are questions, but I don't think there will be. Pretty simple.
I'll check for questions and jump in if there are any.
Excuse me, for some reason I'm getting a call. Let me see what my building's called. Hello? Perfect, thank you. It's my husband ordering dinner and not realizing that they sent it to the wrong apartment. All right, so we are going out to 9 inches. Continuing to move. If you start to feel it stick at all, just throw a little more flour. You don't want to over flour it, but you would rather have it a little more floured than sticky. Awesome. So today I am using apple butter just because that is what I had on hand. I have a PB&J one in my book that's really nice because it's just obviously 2 things that you already have, peanut butter and jelly, and you just spread it on top and roll them up and call it a day. So you really can just take this in whatever you want. You can mix some things, like sometimes I do peanut butter and honey. Sometimes I'll do Nutella and tahini. Kind of just make it yours. Don't overthink it. All right, once I spread a smooth layer on like so, going in, you can use a pizza cutter. I have a little kind of double-sided pastry tool. You can also just use a knife, and we're gonna cut it into 12. So each disc makes a dozen. So that's one way, vertical, horizontal, and then each one goes into thirds. And then to show you truly how simple arugula are to make at home, you then take each triangle and you just roll it up like it is a Pillsbury crescent, and that is your arugula.
Stunning. Looks so good.
Yes. So, I mean, for people, if anyone has any questions, you could obviously throw them out, but.
Okay, I'm gonna ask one. It's Amanda. And I like set up everything. I got the ingredients, but I have celiac. So I was gonna use cup for cup. And this is like this is a trick question because you don't know how to do this gluten-free, or do you?
I mean, if you use cup for cup, it should be fine.
Really?
Something like this, that's a rolled one. It's not as necessary for structure, since this is a really like tender dough that it might, you're gonna have to play around with it. The only issue is with something like gluten-free baking, a lot of starches like potato starch or coconut flour or any of these things, they're much more absorbent of liquid. So
Right.
You sometimes would then need to add just a little bit more butter or just like a tablespoon of coconut oil to the mix. And that will just kind of do it. You just want to look for the consistency.
Right.
You saw the consistency of this, you can kind of mimic it with oil.
Yeah, it looks so good. I kind of wish I had done. I have the ingredients. I'm gonna do it right after we hang up.
There you go. And then I just brush them all with an egg wash and pop them in the oven, 375 for about like 18 minutes. And then it looks like this.
Oh my goodness.
Sorry, I did half peanut butter, half apple butter.
Are the peanut butter ones like savory, or you put sugar in it?
I put honey, but you could also take them savory. So in my book, I'm going to have 4 arugula master dough, this dough actually, and then 4 filling variations, 2 sweet, 2 savory.
Yum. Somebody asked, are there any fillings that don't work? Do they burn or get too wet or anything like that?
Yes. I mean, anything that's going to be like, that just melts. So super, super like runny caramels, things like that. Some things that are really high in sugar will risk burning at the bottom, which you don't want. But that also.
What's an example? Like caramel? Like
caramel sauce, something like that, or even something like a store-bought lemon curd is something I wouldn't do. Anything that's egg-based, since you're baking it more. And then on top of that, I would say things that are too thin. So look for thicker things. So anything that is in the realm of Nutella in terms of sweetness, in terms of viscosity, you are good.
Good to know. Does anyone else have questions? Just how do we come over to Jake's for Shabbat dinner? That's just my question.
I mean, that's yes, that is a coveted invitation, which you will now receive. Ask and you shall receive.
Oof, watch out. You got a lot of people watching.
I mean, well, the thing is, I do so I'm on the board of directors for One Table, which is such an incredible
Talk about One Table.
So One Table, it's a nonprofit all focused about getting people in their 20s and 30s to embrace the ritual of Shabbat into their lives in a completely non-denominational way, just kind of the mentality that we kind of, you look at yoga, and yoga was a Hindu practice that has become mainstream for the sole reason that it's good for you. And we see the same thing with Shabbat. It's self-care, it's pausing, reflecting at the end of the week, building community. These are all super important things, especially for millennials that have such like increased rates of loneliness or kind of troubled relationships with social media. This is kind of that way to combat it all and just build community, especially in major kind of urban cities across the country.
I love it. So go ahead. Sorry.
Through a platform that they'll help subsidize your Shabbat through nourishment. So they'll not only give you all the support of like resources to host a Shabbat your way, whether that be you want to say the prayers, you want to say the prayers in English, or you don't want to say any prayers, and you just want to do these meditations instead. However you find it fitting is great and supported. And then they also help pay for your groceries, which is wonderful.
So great. So there's two things that just reminded me of. One is that Tiffany Schlane, who's watching, who just commented that it looks so yummy, wrote a book called 24/6. I think that's the name of it. Tiffany, write in there if I wrote it wrong so people can get it. Yes, she said yes. It's about how shutting off on Shabbat, she's not a religious Jew, but how shutting off on Shabbat is such a healthy thing to do and how much it's changed her family and, you know, how meaningful it's been to just not be technologically connected. 24/6, the power of unplugging one day a week. It doesn't have to be, it can be a religious thing, or it can just be a mental and emotional health thing, you know, taking a break, taking a rest, and, you know, connecting with the people that you love.
I can tell you, especially as my career has evolved over time, and Shabbat is really only because we didn't grow up kind of having Shabbat on Friday. That's only something that I started, same with my husband. So this is completely a practice that we've brought into our lives only as adults. And I think the more and more, especially having to be so plugged in and working in a digital food media company, and also having to deal with social media and the internet, never going to sleep. It's something that's if and when I leave my current job, that would be the new kind of normal in terms of Shabbat is off limits, even for my own. I won't even post personally, probably.
Yeah. Yeah, it's amazing. Somebody just wrote, I love this, Shabbat changes lives. It really does. I mean, and like Tiffany's an award-winning filmmaker and a writer, and like for busy people, you know, who are working hard and who, especially if you're passionate about your job, and I think you bring it home with you, like, because that's something that I struggle with. I feel like you too, Jake, and Tiffany, I'm sure, you know, to take a day where you're not, you know, you're just enjoying the people that you love, and your time at home sounds lovely and something we can all think about. And with One Table, it's something that, you know, when this is over, I really want to explore the possibility of Zioness working with One Table, because we have 35 chapters around the country, and the chapters are looking for ways to connect. And I think doing a One Table, you know, Zioness Shabbat across the country, with all our, you know, all the chapters doing their own One Table Zioness Shabbats would be an amazing way for people to connect and, you know, talk about shared values and enjoy Shabbat, celebrate, you know, the beauty of Shabbat together. So amazing organizations.
It's great. I mean, I think I tried, and it's a terrible thing when at its kind of core, but I have had just the most incredible connections professionally, personally, through Jewish nonprofit organizations. So I've gotten really to a point where I will not say no to any ask from any Jewish nonprofit.
I saw. I hope we can sell your book. I wish it was coming out sooner so we can buy the book.
It's good that the buzz has started already so early, and we'll just keep it going.
Everyone watching, make sure you are following Jake on Instagram. Seriously, you will only regret it at 2 a.m. when you're hungry. Otherwise, you won't regret it at all.
I mean, it was a really crazy situation because we shot the book a few weeks ago. actually a month, it was just like the month mark. So it was the last week before New York shut down, and we were actually considering pushing it. We weren't sure if we was going to go on. I was like planning contingency plans if I had to then like take my car and pick up my photographer and my stylist, because if the subway shut down, we didn't really know what was going on.
Right.
And we wrapped the day that New York went on pause, got announced. So it was we really lucked out, and it was down to the wire. And
I'm happy you got it done.
done.
So I have another question for you, because people aren't asking questions. Also, we can end this anytime, but I'm so curious, for someone who cooks, I cannot stop eating because I'm stuck home. I'm safe at home. I hate that I say stuck at home. I'm safe at home, and very, very grateful for that. Yes. But I can't stop eating. And how do you not just cook and eat all day, or do you?
That's all.
What you do.
So my husband's birthday's tomorrow. So
happy birthday.
Just all cooking all weekend. So this is Friday night is typically now our ordering night, funny enough.
Oh, funny.
In this, because of the fact that I'm in a very like marvelous Mrs. Maisel urban kibbutz, where I live in the same building as my sister and my mother.
Wow.
And so like my sister, her fiance, and us are quarantining together. So I'm cooking for all of them every night, which is something that's so different from the norm. So having a full-time job, and then also playing like
home chef. Okay.
So
you're not for hire. For everyone who's curious.
But I actually do love that. Sophie says to name my next book, Urban Kibbutz. That's actually pretty cute.
Really good.
Let's go. So I had this joke with my stylist on the shoot, because Melissa Clark, who's a well-known food writer for New York Times, had this book called Dinner, and then she had her next book called Dinner in French, and it was all French style things. So then my stylist said, "Oh, your next book should be Dinner in Yiddish." And I love that concept. But at the same point, this book is going to be super interesting because I'm Ashkenazi. So there's a huge amount of Ashkenazi food, but my husband is Mizrahi. He's Persian Iraqi. So it's like this love story between us exploring both of our kind of backgrounds in food and connection through Judaism. He had never had babka or gefilte fish or any like matzo ball soup. He didn't have any of it before he met me, and likewise, I never had.
Never had matzo ball soup?
He never had it. He grew up in Florida, and he was born in Switzerland, then he went to Florida. So it was this situation that did not allow exposure for Ashkenazi food, because his mother is Iraqi, and she was making tadik and kubba and all these things that I had never been exposed to until we started dating.
Now you're a pro. That is all over that Instagram.
Yes, a lot of tadik. There's a whole tadik section in the book. There's a lot of like, it is truly my baby, my pride and joy. I have put so much into it, and it's going to be fun. I mean, it all started because of the Shabbats with One Table. That's how I kind of built this community in New York and our connection. We were kind of debating whether if we wanted to join the congregation in New York, and we were trying a lot out, and we just couldn't really vibe with one. And then we decided that we were going to go to the synagogue of One Table and build our own Jewish community. And a lot of these people coming to my Shabbats are also people who haven't had Shabbat since they were like 12.
Right. And it's such a good way to connect to the community, not necessarily religiously at all, just like
exactly.
Part of something. It actually, you just reminded me, I did a webinar last week with our board chair, Archie Gottesman, who runs Jew Belong. I don't know, Jake, if you've heard of Jew Belong, you would, I just knew you would like it. And so it was the night before Passover started. And someone on the webinar asked a question saying that their family wasn't feeling 100% connected to any of the synagogues in their community. And they were really looking for one that was like 100% run. And Archie actually said, and we got into this whole conversation of like how to build your own Jewish community and how to build your own Jewish tradition and practice, and, you know, how you can find beauty in so many different ways that aren't the same traditions that, you know, other Jews have, but like you can make it your own. So your story, I mean, the story you just told is literally exactly what we were advising. So I guess it was good advice because you seem very Jewishly connected.
Yeah. I mean, that it came down to the fact of we kind of started as a way we wanted friends. We didn't really have a lot of friends in the city, and this was this way to kind of connect with people. And it was just so disarming. I have had like really like crazy people come to my Shabbats, both in the food world and not food world, just because like, I'm not asking someone for a favor. I'm like, come to my home and let me cook you dinner. It's what kind of the largest extension of hospitality that you could do is inviting someone over for a Shabbat, because it's the holiest of nights and you're going to be like welcomed into someone else's home.
It's so true. It's so true. I didn't grow up with Shabbat, and I want to have Shabbat in my life because of how much meaning and connection it brings. So thank you so much for sharing this with us.
Of course.
Someone said we have to do another demo when your book comes out. That's a given.
Sure. Trust me, there'll be nothing but demos. Everyone will be sick by then.
You're going to be like pre-recording them and just distribute it quietly. Every night there's going to be another demo. But yes, we would be honored to do more demos with Jake anytime. Jake, thank you.
Of course.
You're so great, and you just seem so fun, and I'm really grateful that you did this. Sophie, thank you for the idea. Sophie, who is professionally connected to Tish and personally connected to Jake, had such amazing ideas for this evening. Sophie Neer, thank you. We're applauding you. Thank you for helping us put this together. And thank you everyone for joining. Sorry, go ahead.
I'll see you at Shabbat.
See you at Shabbat. Shabbat Shalom, everyone. Please stay healthy and safe. Stay connected to Zioness and to each other. And thank you. Oh, wait, there's two more questions. Oh, wait.
Oh, two more?
Oh, Sophie said milk chocolate or dark chocolate. And also, when is Jake's cookbook out and where can I buy it?
You can buy it wherever fine books are sold. It'll be on Amazon. Support your local bookstore. And in terms of milk chocolate, dark chocolate, I actually typically do half and half.
Oh, I like that.
Half and half. Always
I like
half and half.
Okay, I should also say for anyone who's still here, if you're not signed up for the other Zionist webinars coming up, we're doing one on Monday with New York City Council member Richie Torres, one on Wednesday with trailblazing LGBT Rabbi Denise Egger, and Thursday with CNN commentator Bakari Sellers. So make sure to check out our upcoming events, and we're going to announce more in the coming week. So that's it. Shabbat Shalom.
Shabbat Shalom.
Good night.